Hi everyone, we are a team of 28 youth in grades 8 to 12 from communities all across BC. We just finished a research project with youth in BC to hear about their experience with vaping. We also wanted to see how youth might have been affected by the pandemic, including things like mental health. We created this video to share back what we heard from the youth in our province. This project is a partnership between the McCurry Centre Society, a BC-based youth health charity, and the BC Ministry of Health and the BC Lung Association.
In the spring of 2020, we were hired by McCurry and trained to develop and share an online survey with our peers. The survey was created with support from McCurry researchers and experts on youth vaping. We shared 3 different surveys. The first was in June 2020, and the next surveys came out in September and December. Some questions were the same on all 3 surveys, and others changed to reflect the different stages of the pandemic.
We collected over 3,500 surveys from youth across BC. The survey was open to all BC youth, including youth who have vaped and youth who have never vaped.
Now we will share the results.
Youth who filled out their surveys ranged in age from 12 to 19, with an average age of 15.
Over half of the youth identified as female, 38% identified as male, and 4% identified as non-binary.
Youth from all across the province took the survey, including youth in the North, Interior, Island, Fraser, and the Vancouver coastal area.
Youth most commonly identified as European, followed by East Asian, Southeast Asian, and Indigenous.
Most youth who filled out a survey had never vaped. The percentage of youth who had vaped ranged from about a third on the June and September surveys to about a quarter on the December survey. In June, youth were more likely to say that they last vaped before the pandemic started. But later this changed, and youth were more likely to say that they had vaped during the pandemic.
Older youth were more likely than younger youth to have ever vaped. For example, 39% of 16 to 19-year-olds had ever vaped, while 6% of 12 to 13-year-olds had.
We asked youth how many days they vaped in the past month. More than 1 in 3 youth who had vaped recently vaped daily.
The survey also asked youth how soon they vaped after waking up. Among youth who vaped daily in the past month, 75% had their first vape within the first 30 minutes, including around a third who had their first vape within 5 minutes of waking up.
Youth who experienced higher levels of stress were more likely to have vaped recently than those who experienced lower stress levels. For example, 34% of youth who experienced extreme stress had vaped in the past month, compared to 7% of youth who experienced only a little stress.
Youth were also asked if their stress level was higher, lower, or about the same now compared to before the pandemic. The more time that had passed since the pandemic started, the more likely they were to say their stress levels were higher now. In December, nearly half of the youth said their stress levels were higher now.
Now let's pause for discussion. What do you think some of the different causes of stress might have been for youth in June, September, and December 2020? How do you think these things could have affected youth vaping? If you're taking time for discussion, pause the video now. Otherwise, let's move on to some more findings.
We asked if youth lived with someone who vaped, and 1 in 5 did. Most of these youth said it was their sibling, and 21% said their parent or caregiver. Youth who lived with someone who vaped were more likely to have ever vaped, and to have vaped during the pandemic. We also asked about having friends who vape. 56% of youth had close friends who did, and 36% had 3 or more.
The more friends youth had who vaped, the more likely they were to have vaped themselves, and the more likely they were to have vaped during the pandemic.
We asked youth if they had seen ads for vaping products in the past month, and around half of the youth said they had. The most common places youth saw ads was on social media.
We also asked youth where they would go if they wanted reliable information about vaping. Youth who had never vaped were more likely than those who had to say that they would turn to an adult, such as a doctor, adult relative, teacher, or school nurse. In contrast, youth who had vaped were more likely to turn to their peers, older youth, the internet, and social media.
We asked youth who had never vaped about their reasons for not vaping. More than 8 in 10 youth said it was because they thought it was bad for their health and because they weren't interested.
Youth most commonly saw vaping as equally harmful as smoking cigarettes, but youth who had vaped were more likely to say that vaping was less harmful than smoking than youth that hadn't vaped.
We asked youth who had vaped about all their reasons for vaping. They most commonly said it was because there was nothing else to do, their friends were doing it, and they wanted to try it. We saw some differences when we looked at youth who had vaped recently compared to the youth who had last vaped before the pandemic. Youth who vaped recently were more likely to say the reason they vaped was as an alternative to smoking cigarettes and because they felt addicted. They were also more likely to vape for emotional reasons, such as feeling anxious, sad, and bored. In contrast, youth who last vaped before the pandemic were more likely to say it was because they wanted to try it and because their friends were doing it.
Youth who had vaped were asked if their vaping had changed in the past 3 months. On every survey, youth were more likely to have stopped or reduced their vaping than they were to have started or increased. But in December, we saw that more youth had been starting or increasing their vaping than on past surveys.
The majority of youth who vaped had shared a vape with someone at some point, and over half of these youth had done so during the pandemic.
Youth were most likely to get their vape juice from another youth the last time they vaped. But those who vaped during the pandemic were less likely to have gotten it from another youth than those who last vaped before the pandemic. Also, in December, we saw that fewer youth had bought at a store compared to in June.
Let's pause for another discussion. Why do you think more youth were starting to vape in December than earlier in the pandemic? What do you think are some of the factors that influence youth's decisions about vaping?
Around 60% of youth who had vaped said they wanted to reduce or stop vaping. We asked what their reasons were, and the most common response was that they had lost interest. Other common reasons were because they were worried about their health or because they were not allowed to vape at home.
Most youth were not aware of resources to help youth stop or reduce their vaping, such as Quit Now and HealthLink BC, although by December, more were aware of Quit Now.
This survey included an open-ended question about what youth wanted to learn about vaping. The two main topics youth wanted to learn more about were the harms of vaping and the reasons youth might vape.
I want to learn about the lifelong effects of what vaping can do, what it can do to your lungs, and possibly if it's safer than smoking weed or smoking a cigarette.
I would like to learn how to quit vaping. I've seen lots of resources to keep youth from vaping, but nothing on how to quit.
Why do people feel the urge to vape? Does vaping really help people calm down from a psychological standpoint?
There were also suggestions for schools to teach youth about vaping and to create opportunities for youth to engage in discussions about the topic with their peers.
I would like to have actual education instead of fear-mongering by adults.
Schools should talk about vaping more.
Vaping has not been focused on in schools the same way smoking has. This makes youth believe vaping is healthier. Another open-ended question asked what youth thought schools could do to support students. Some youth who hadn't vaped suggested things like monitoring, having stricter consequences, and teaching youth about the harms of vaping. But others felt this kind of approach might not be helpful for youth who already vape, and they suggest more supportive and non-judgmental approaches. Many youth said it would be helpful for school staff to learn about why youth might vape, and to be more aware of mental health symptoms and addiction. Giving them all the information around vaping, the positives and the negatives, and allowing them to make the decision once they have all the information. Also educating parents around it.
Don't shame students for vaping. Acknowledge them and their feelings, then help them on their terms.
Perfect.
They could help the kids that are addicted to get help, and to stop kids from starting, they could introduce more mental health supports. Now that you've heard all of these findings, what do you think would support youth to make the decisions that are right for them when it comes to vaping? How can youth who want to reduce or stop vaping be supported to do so?
If you have an idea for a project related to vaping that you would like to do in your school or community, you can apply for a youth action grant for up to $500. The grants were created by McCreary's Youth Advisory and Action Council to support BC youth aged 12 to 19 to deliver projects to improve youth health. You can visit McCreary's website for more information.
Thank you for listening. You can see the full report and an infographic we've created to share the results with parents on McCreary's website. We just wanted to leave you with the reminder that you're not alone, to reach out, to support each other. And if you're looking for more support for mental health or to reduce or stop vaping, check out some of the resources on the screen. We hope this has given you some interesting things to talk about, and that the information can be used to support youth in your community.